Hi, my name's Gary Wittert. I'm on the land of the Ghana people today, and I pay my respect to elders past, present and emerging. I work at the University of Adelaide in the South Australian Health and Medical Research Institute, the Royal Adelaide Hospital, and I head the Centre for, what's the Freemason Centre for Male Health and Wellbeing. I'm going to talk today a little bit about the prevalence and complications of obesity in males. And men are more frequently affected by obesity than are women, and also have much more rapidly increasing, very severe obesity than do women, and we see a similar trend in boys. And that's also important to recognize that there are a small proportion of people who are underweight. And that also represents a problem that needs to be dealt with, so that nutrition across the weight spectrum is extremely important for maintaining good health. Another thing to consider is the way we measure obesity. So often we do it as body mass index, but that includes a significant component of muscle mass, so that for someone who's a bodybuilder, they may have a high body mass index, but may not be obese. And with increasing age, as muscle mass is lost, body mass index may be lower relative to the degree of fat mass. And so it's extremely important that waist circumference gets measured with a tape measure around the waist as the main indication of the extent to which weight is going to confer a risk of disease, either at that point in time or subsequently. So I study the complications of obesity in men, and this matters a lot, because these complications are seldom found in any of the pictures that you might see in books or websites describing the complications of obesity. And when men understand that these problems are linked to their obesity, it drives behavior change. So erectile dysfunction, commonly associated with obesity, but also associated with other complications of obesity, such as sleep-disordered breathing, where you block the breathing tubes at night and cause the oxygen level to fall in the blood. Also, when there's buildups of unhealthy fats in the blood that block the blood vessels, and with diabetes. Low blood testosterone is not due to increasing age, it's due to increasing fat mass, which often occurs with increasing age. And when weight is lost, testosterone comes back to normal. We've recently completed a big study showing exactly that. Waterworks problems, when people get up frequently at night to pass urine, occurs in both men and women, and it's not the prostate in men. And of course, women don't have a prostate. And it's more likely to be due to obesity or the complications of that, like high blood pressure, abnormal blood glucose metabolism, or sleep apnea. And you can also get these conditions during the day of frequency and urgency, which represent overactive bladder. Enlargement of the prostate itself, benign prostatic hypertrophy, also an obesity-related condition. And then when men get their PSA measured as a screening for prostate cancer, in men who are affected by obesity, the PSA tends to be lower, which means that the prostate cancer ends up getting diagnosed later and at a more advanced stage. Yet to date, there is no correction for that in any of the tests. And then finally, just like there are effects of obesity on reproductive capacity outcomes for women, as well as the children born to women who are affected by obesity. Same in men, there are abnormalities of sperm affecting how they move, how they look, what the genetics of them are, leading to loss of fertility, but also importantly, transferring the risk of chronic disease to the children that are born, and that may occur down not just one generation, but down 2 generations. And then finally, because we're in the age of COVID, it's important to remind everyone that men are twice as likely to die from COVID-19 as a woman. And that is predominantly because of obesity and obesity-related complications, in particular diabetes, hypertension, and cardiovascular disease.